listening to the Pharmacy Podcast Network.
Pharmacy benefit managers, better known as PBMs, are responsible for negotiating payment rates for a large share of prescription drugs distributed in the United States. Recently, state Medicaid systems, policymakers, and national pharmacy associations have expressed concern that certain PBMs' business practices may not be consistent with public policy goals to improve the value of pharmaceutical spending. This podcast series is all about PBM reform. Listen to the discussions, share these podcasts, and help build a new pharmacy payer system which supports our independent community pharmacies, encourages fair and transparent competition in the marketplace, and most importantly, is designed to deliver the best patient care.
Hey, welcome back to the PBM Reform Podcast. Somebody that is a crusader, who is a parent who understands what PBMs can do to their child's care, which infects them and their own health, is Loretta Boesing, and I'm proud to know her. I'm proud to have her in my network. She's a champion, like I said. UniteForSafeMedications.com. Once again, that's UniteForSafeMedications.com. Loretta, welcome back to the PBM Reform Podcast.
Thank you so much for having me, Todd. I'm so excited today to be here. I'm thankful also that we have a special guest. We have Shanon Schmidtknecht with us, and I'm just really thankful that she's going to be part of this conversation. And as we are getting to know each other too, hopefully working together to kind of help empower other patients and use our voices to create some type of change.
Shanon, welcome to the show. We are so honored to have you here, and we thank you for spending time with us.
Thank you. Thanks so much for having me. I appreciate it.
So, Shanon, I think of the pharmacist as the patient protector. And it's very relevant that you shared a new website with us, which is patientprotector.us. And for our listeners, that's patientprotector.us. Take a look at that. And this goes through patient stories, patient articles, making a difference, what the problems are, how we're educating America on the bent and broken healthcare system that is not doing what it was initially designed to do, which is pay for services that we need, that we go through with our children, with ourselves, with our loved ones, and get out of the friggin' way of our providers, get out of the way of our physicians, get out of the way of our pharmacists and our nurses, and allow them to care for us and our families and our children. And that's just not the way it is today. We have PBMs and insurance companies and prior authorizations and everything and anything to keep the money in the form of profit and not the form of healthcare. And so when I met Loretta, and Loretta brought us to you, and we all met through Twitter, which is just hilarious how powerful social media can be. This is a very important story that our listeners have to listen to. But listeners, this is an assignment for you. This isn't just about listening. I need you to take this content and I need you to share it with policymakers. I want you to share today's podcast with 3 or 4 policymakers in your state and think, we're getting 600, 800, 1,200 listens to this podcast in the next 30 to 45 days. If everyone that listened to this podcast sent it to at least one policymaker, think of the information that we could drive. It's the truth. It's what's happening at the grassroots. And with that, Loretta, I'm turning this over to you just to open up and share with us about Shanon's story.
Yes. So for me, first, let me start back with pharmacy benefit managers and PBMs, because we're going to be sharing this with, people in our local community too. And I just want people to know, pharmacy benefit managers, it sounds complex, sometimes PBMs, but it's really corporations that most are familiar with: Optum Rx, CVS Caremark, Express Scripts. A lot of people know those as mail order pharmacies, but they're also what's called the pharmacy benefit manager. So, for me, our family was impacted by PBMs early on. I didn't even know what a pharmacy benefit manager was and how much destruction they were causing patients across the nation until we were forced to a mail order pharmacy that risked my son's life. And for me, that was when I started Twitter at the request of the U.S. Department of Labor. He said, you should really start Twitter. And I'm so glad that I did, because you're right. That's where I've connected with so many amazing people. Shanon's story is one that I came across. And usually when I see the news headlines, if I have an opportunity, the first thing that I do is I try to reach out to those patients that have been impacted. And so that's how I connected with Shanon. And Shannon's story, I think for me, after uncovering, what pharmacy benefit managers are doing, is my worst fear. And I think for anybody listening, for any patient, for anyone who has a loved one who relies on medications, they need to hear Shannon's story. They need to know, what can happen if we do not get these PBMs, held accountable, and we don't get regulations to protect us. Shanon had lost her son, and Shanon, if you would like, would you feel comfortable going into the details of that? I don't want to, say something incorrectly. I'd rather it come from you and with what you feel comfortable in sharing.
Sure. I also had never heard of a PBM. Again, like you said, Loretta, I had heard of those names, those company and business names. But I didn't know what a PBM was until after all this happened. This is all very fresh and new for me. My son, Cole, passed away, sorry, in January of this year, from a very preventable death. And that is what is so frustrating and angering to me. Cole had asthma, a very common disease. My husband has asthma and is 47 years old, right? He's had it his whole life. Cole also had asthma his whole entire life, was allergic to everything under the sun. And that was just kind of part of life. He was on a steroid medication called Advair discus, probably since he was 11 or 12 years old. And it was well managed, no issues. He played sports. He was a very good athlete in football in high school, really just had no issues with his asthma as long as he, had his Advair and went on with life. In January of 2024, Cole walked into a pharmacy here in Wisconsin and went to fill a prescription for Advair. And again, had been on it for years. He was told it would cost him $539.10. Like I said, Cole was 22. So $539 was his rent. There was absolutely no way he could pay that. And so he left with no medication, no alternative, no nothing. He was given a rescue inhaler, which is also something he's prescribed for his asthma, which is supposed to just be as needed for asthma attacks. The steroid inhaler is his daily medication to, maintain his asthma at a livable level. So he left with just that rescue inhaler at a $5 copay. That was January 15th. I'm sorry, that was January 10th. Wednesday, January 10th, Cole left that pharmacy with just that rescue inhaler. By January 15th, he was texting my husband saying he was struggling. He was having an asthma attack. He also had a nebulizer at home. Again, we've had that for years for Cole because he, when it did, allergy season, whatever it might be, he's occasionally needed a little extra support. He was trying to use the nebulizer machine and wasn't successful. So he texted my husband and just was like, any suggestions? And my husband said, let me know what you need, et cetera. Again, it was just text messages. About an hour later, he got a phone call from Cole saying that he was really struggling, and Bill, my husband, could hear it in his, voice, of course. The asthma was kicking in pretty hard, and Cole said, I need to go to the emergency room. Sadly, Cole's question was, where should I go for my insurance? And I wish that wasn't a question any of us had to ask. You just go to the emergency room, wherever you need to go. But even at 22, he knew that was a factor, right? So again, my husband said, it doesn't matter. We'll figure that out later. Just get to the ER. So his roommate happened to be home that night, and they lived maybe 7 minutes from the local ER, and they got in the car, and within that 7 minutes on the way to the emergency room, Cole suffered a cardiac arrest in the car with his roommate, and was lifeless and pulseless by the time they got to the emergency room. They were able to resuscitate him, but the amount of time was unknown at that point, how long he had gone, without oxygen to his brain. He ended up in the ICU on a ventilator for 6 days. But ultimately we were told that the damage to his brain, it was just too much.
Sorry.
He would just be ventilator and feeding tube dependent forever and would never wake up.
I'm so sorry.
Yeah,
I'm so
it's
sorry.
awful.
The story of what Shanon went through as a mother, as a parent, relying on her pharmacy insurance, her pharmacy PBM insurance to function as we all think that it will for our own care and the care of our children. It doesn't seem like it's very complicated, nor should it be complicated. And it certainly shouldn't be profits and process and keeping the medications needed for people to live better, live healthy, and in this case, stay alive. And instead, these processes are built, the complexities are set up, and it shows you that PBM reform must take place for public health safety and for the safety of people throughout the communities all over the country that rely on their community pharmacies. We're going to take a short break and listen to a quick message from our sponsor.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
We are back with an amazing conversation between two mothers who are battling still to this day for their children's health. Loretta, you are a champion of not only your own family, your son that relies on his medications, but us as consumers. You're fighting for us too. And Shanon, the heartfelt story that you just shared about the loss of your son, this can be turned into something very, very powerful for our pharmacy profession. And joining together with our efforts to get more attention around PBM reform. If you're listening, please share this podcast episode with your local state and Senate representatives. Get this to them, share this with them. It's amazing how Shanon and Loretta share a background of what they did as social workers together.
My degree is also in social work, so I have that heart of a social worker also. So it does something to you where you do feel like you want, well, my passion was always hospital social work. So I was always really interested in healthcare already. But I was not prepared to be confronted with the many issues that patients were experiencing due to insurance. That
Yes.
where I grew up at was always like, people have insurance, you get a job, you get insurance, it's good insurance. But there is no longer in America do I feel like we have good insurance. I don't know where you can find good insurance at. Some people say, to use the direct primary care and then use, your insurance as catastrophic coverage. But it feels to me like we are already kind of doing that. I mean, for my family, we had to drop our employer sponsored coverage because they were going to force to CVS and CVS mail order. And I'm like, we cannot do that for my son. Now, my husband kept his employer sponsored coverage. And a story about that is just recently, CVS had, first they have CVS Caremarkers or PBM, of course. My husband has asthma. He went to get his inhaler filled it at the local independent pharmacy, gets an email from CVS saying, we're going to mail this to you on the 13th. My husband's like, I haven't communicated with you. I haven't provided you any information. What is this email? How did they get that information? And of course, it had to be from the PBM. And, as far as we know, we didn't, unless the pharmacy contacted CVS, I'm sure that they didn't. I believe, if anything, CVS might contact the pharmacy to try to still that. I'm sorry, but that's stilling. That wouldn't be okay anywhere else.
Right.
Can you imagine, like, if you were to DoorDash McDonald's and all of a sudden you get Burger King? Like, no, we wouldn't take that. So it's just very interesting to me how in America we've just slowly been like transformed into this, to just accepting it. And it's time to say, no, we are not going to accept this. You know what? And I was unaware that this was happening too, and that that patients weren't being told that there was a cash price that could be lower. Did you find, so I think I read somewhere that your husband was told that there was a lower cash price for his. So had you always known that, or was that something you learned recently?
Yeah, similar to what you just said about your family situation. We had no idea that. So my husband and Cole were on the same insurance. They worked at the same company, different locations. And it wasn't until my husband went to pick up his Advair, same medication, same insurance, that we realized all what had happened with Cole, which I will never forget. Kind of that day, like, oh my gosh, this is it. This is what happened to Cole and why he didn't get his medicine that day. The difference is Bill picked his up from an independent pharmacy, where the pharmacist took 3 extra minutes to be like, wait a second, this doesn't make sense. There has to be an alternative. You can't just, I'm not, she literally said the words, I'm not letting you leave with nothing. Except for Cole's pharmacist didn't. So if there's a message that I can give to pharmacists, it would be please take the 2 minutes that it takes to see if there's an alternative, because there was for Cole. According to his PBM, OptumRx, there was alternatives. They were not provided to Cole. We don't know why, all these things. But nevertheless, Bill was, my husband was offered alternatives, and within 12 hours went through quote unquote step therapy and was then given his medication that he was prescribed, which is, I mean, honestly comical that 12 hours of, and really it was overnight of being on one medication. Now you've completed step therapy and now will allow you to be on the medication your doctor prescribed you.
Wow.
So, yeah.
And, you think about that, the 2 minutes, if the pharmacist had 2 minutes, do you know the pharmacy that your son used versus the pharmacy that your husband used? Do you think the pharmacy that your son used would have had the time? I mean, I know that we say they should make the time regardless.
Right.
But is that a pharmacy that's usually staffed? Do you know?
I mean, according to what we see, on the news and stuff, no, it is not.
Yeah.
Mm-hmm.
And so that's always why I feel like personally that independent pharmacies are the safest pharmacies in our nation.
Yes.
So a lot of people are like, Loretta, how did you transform into this pharmacy, saving advocate? And that is why, because
that's why.
Yes. And we used a hospital pharmacy at the beginning of my advocacy. And I felt safe there too for my son, because in the beginning, he had to have medications that was in liquid form. And the
Sure.
pharmacies here didn't feel comfortable doing it. At least then I went to chain pharmacies because I didn't even know what an independent pharmacy was.
Right.
A lot of, if there's any new listeners, something that I had to learn along the way was indie pharmacy. INDY is what a lot of independent pharmacies, small locally owned pharmacies will sometimes refer to themselves. And at first is like, indie pharmacy, what is that? And
yeah.
And now not only do I know what they are, but hearing that 30% of them are expected to close due to the abuses of pharmacy benefit managers. So those who don't know, pharmacy benefit managers can also oversee they do oversee the reimbursements to their competitors, to these small locally owned independent pharmacies. So of course, guess what they're doing, and I hate to keep using fast food again, but, imagine what McDonald's would do to Burger King if they could oversee how much we paid
Right.
for the burgers at Burger King. Of course, it's going to put it out of business, So, and at some point, it's going to hurt the workers and they're not going to be able to be staffed. And then it's just slowly they fade away. And we just can't
Right.
let that happen to our pharmacies in America, and especially not the safest pharmacies.
Mm-hmm.
When I spoke at Missouri Pharmacy, a legislative day, I shared your story. And as I shared your story afterwards, I went into the pharmacy closures and I broke down in tears for a moment, because it was just thinking about your story and then thinking about what's going to happen if we lose our locally independent pharmacies that let us know when the cash price is lower,
Mm-hmm.
that have that time to take with us to counsel us. It's just sad. Like, how could we let this happen to them? And why are our legislators allowing this to happen to us, to our communities, to our nation? It was heartbreaking to learn of that. So did you know that was happening beforehand, or was this new to you as well?
New to me as well. All of this is new to me. But I couldn't agree more. The independent pharmacies that, all of my friends and family members now have moved their prescriptions to independent pharmacies, because you don't know what you don't know. And we didn't know. And I'm so obviously saddened that it took this for me to know this stuff, which is what it is now. But, the pharmacy that my husband we all go to now, that my husband went to, not only did she offer that extra few minutes to figure this out for him, but she knows us, right? She knows what my husband takes for medication. She knew that our son had passed away. She knows us. Whereas kind of those big box, if you will, pharmacies, you're just a person in the line to get in and out. And sadly, I fear that is what happened to my son. Is he was told it was $539.10. And when he couldn't afford that, it was like next in line. Yeah. And he's 22. He didn't know to Yeah, I don't know. I don't know what he knew and didn't know. All I know is he's no longer here from that experience.
Oh gosh, it just still makes me sick to my stomach. I just can't imagine as a mom, and like I said, I will fight with you to make sure all that I can to ensure that it doesn't happen to another child. If I can stop it, if I can stop it from happening to another patient, I will, because this is all happening for greed. It's not because it has to happen. Right. It's not because our legislators can't do more. Unfortunately, they're not, though. They're not doing enough. They're not acting fast enough. The Federal Trade Commission needs to, this should have never been allowed to happen in the first place, but we need help now because the greed is out of control. I know that I had through Messenger, we spoke a little bit about Wisconsin, earlier in the year, having these hearings where they spoke about some of these issues. What were your thoughts listening to that? I know I shared that with you, and I know that was a while back, but do you recall some of that?
I do. And it was hard. It was empowering at first to watch because, the whole beginning of the session, if you will, was all about kind of what we're talking about and sharing stories and advocating for change. And then kind of it's almost like this eerie, silent person from behind coming in and being like, oh, we can't do that, you guys. But without really saying that. And it makes me, I can't, beyond angry to think that money is driving our lawmakers to make decisions rather than lives. We did meet with, our governor's office. We're meeting with the Speaker of the House, et cetera. I don't know my political things, lingo. But yeah, because to think that money in the back pocket is dictating laws versus patient care and lives is sickening.
Agree. Yeah. And the other thing that they use that. So of course we know that they're, lobbying our elected officials in ways that I don't know about you, but I work 40 hours per week in addition to my advocacy. Everything I do is volunteer. It is extremely hard to keep up with when they've got lobbyists they're paying by the millions to be able to be out there to conquer our voices. And that's one thing they do. And then did you also hear the fear component? So they also use fear that costs will rise.
Yeah.
And I look at that and I hear that, and I'm just like, our costs are already rising. And actually, in your case, it sounds like there was an option for your son to have a lower cost medication. They just didn't openly, broadcast that or let him know. So I think there is one way that we could have some type of regulations to protect us is to have some type of mandate that will tell patients, pharmacists have to tell patients when a medication is available at lower cost. I don't, as much as I wish that we could just say, pharmacists, please do this, and they do it. When you have the monopolization that we do, unless it's mandated, I don't see them doing it. So,
no,
we need that as patients, and that should be a simple ask. It should not be hard. We should easily have that at a minimum. So that's where you see a lot of transparency right now in drug costs being discussed. But when I hear them saying, oh, but that will raise prices, it's like prices are already going up. And we're not, I believe I read an article that said that the pharmacy benefit managers had actually decreased the amount of medications that were covered on the formulary list of covered drugs by 900%. So not only are we not being told about more affordable options, but they're also removing a lot of options for us. And what that does to manufacturers of medications, a lot of times we see that keeps them from making some medications that are really vital to patients in America. And that's where we see a lot of drug shortages, I believe, is caused by that as well. So
Absolutely.
I want to make a point. Insurance companies, whether they're a PBM or an insurance company, they do not take an oath. Okay. The entity of an insurance company does not take an oath to protect the public. A pharmacist and a physician, even a nurse for that matter, they literally take an oath. And it's a tradition of promise to the public that the responsibility, the education, the money that our physicians and our pharmacists are spending to become educated as stewards of health, of protectors of health, comes back to the oath. So I'm showing on the screen, if you're riding in the car, if you're jogging, you're listening to this podcast, you may not see this on the screen. If you're watching us on YouTube, the oath of the pharmacist is, I promise to devote myself to a lifetime of service to others through the profession of pharmacy and to fulfilling the vow. And the vow includes to consider the welfare of humanity and relief of suffering is my primary concern. Also, the inclusion, embrace, diversity, and advocacy for justice to advance health equity, and also the knowledge, the experience, the skills to best of their ability to assure optimal outcomes, to protect and the personal information, to accept the responsibility of my professional knowledge and expertise and self-awareness, to hold themselves accountable of the highest principles and professional morals, ethics, and legal conduct. I can stop right there. Every single one of these, the PBMs are not adhering to, okay? We just know that the PBMs allowed the personal information to be extracted by a hack that just happened because they didn't have enough, infrastructure to protect patients' information. So that was hacked. Entrusted all the personal information entrusted to the pharmacist, the individual pharmacist, the independent community pharmacist protects your information at all costs. That was broken into based on the lack of what the PBMs has set up. So the point I'm trying to make is the American people have allowed insurance companies to take the place of our providers. And it was never supposed to be that way. It's being led by the insurance companies instead of being led by the providers, the physician, the pharmacists, and the nurses who took the oath to not only keep you safe, keep you healthy, but most importantly, back to Shannon's issue and the loss of our coal, is the loss of life. And they are there to make that not happen. The insurance companies did not take that oath. That is not part of their business plan, okay? So if they need to stay in existence as a business entity, you must get behind the providers. You must get behind the pharmacist. And that is not what we're looking at right now. The $534 or the $500+ that was required to get Cole his medication, if we would have the right organizations in place and a community pharmacy standing there, and they got the phone call from Cole's dad and they said, listen, my son is having a major issue, they wouldn't say, that's $534. They'd say, get the hell down here as quickly as possible. Get the inhaler. Do you need me to call an ambulance? Let's coordinate care. We're going to worry about payment later, because the important thing right now is making sure that Cole can breathe, for God's sakes. So I want our listeners to understand that you are part of a bent and a crooked and a broken healthcare system that is public health enemy number one. The PBMs are healthcare's public number one enemy, and they're causing people to lose their lives.
Right. Absolutely. And without any consequence. What consequence are these PBMs going to play for the risking of lives? And that's where I've just had enough. I'm done with, we have tried so hard to get our legislators and, our the FTC, state boards of pharmacy, to do more to protect us. We just haven't got it. And so that's where I'm ready to start protesting. We're organizing protests at Express Scripts. I plan on, Shanon, we're going to do Optum next and CVS Caremark, because we need the public outcry. We need people, pharmacists have been fighting this issue for so long, and many of them have had to be afraid of retaliation as they're fighting. So that's how we got here, is because once they had that power to be able to oversee the contracts of their competitors, it caused their voices to almost be muted. When I first started, most of the pharmacists on the screens were appearing as shadowed figures on the television screen, speaking, out of fear that they're going to get audited out of business. Some have, that they were going to lose their contracts. Some have. It was real fear. Some say they also faced retaliation from boards of pharmacy and for speaking. It shouldn't happen. That's why I just feel like we need more, but we need the public in our local communities to start getting involved as well and start reaching out to the legislators and do more, because Shanon can't fight this on her own. Loretta can't fight this on her own. These pharmacists cannot fight this on their own. It's going to take thousands of us working together and coming together and just saying enough. We're not going to let this happen. And we're not going to, we're just not going to allow it. And I just hope that if there's something that pharmacists and patients take away from this, I just hope you see too. Shanon, for me, I learned a lot from the pharmacists that didn't see me as someone who lacked knowledge and wasn't worth their time. But pharmacists who reached out to me and said, Loretta, this is why this happened. And this is how we got here. And this is where your voice can be heard and how, we can help you create change. Did you have that experience as well with pharmacists?
Yeah, definitely. In particular, I go back to the pharmacist that helped my husband, which obviously that scenario wasn't life-threatening at the moment, thank God. But it was through her that we learned about all this. It was through her that she really started this, kind of lit this advocacy fire in us. And introduced us to people like you and all of these other amazing people that are advocating for change in PBM reform. And that, she ultimately, when she helped my husband get that medication, I think their pharmacy ended up losing like $11. But it was like, that's what the right thing to do. He needs his medicine. I'm not letting, again, she specifically said, I'm not letting him walk out of here without anything. And as much as I appreciate that, and as much as I adore her for all that she's done for us in terms of all of this and advocacy, that's not okay. Yeah. Because like you said, these independent pharmacies, they can't survive when they're doing the right thing, but at the same time losing money in order to do it. So they're doing the right thing because of that oath that Todd just mentioned. They're doing the right thing because it's what's right to do for the patient. But in the end, from a business standpoint, they can't keep their lights on at the end of the day if they lose money every time they do that. So it's backwards. And that's where she kind of lit that advocacy fire in us.
That's great. So I hope more pharmacists will do that. Go ahead, Todd.
The thing is, Loretta and Shanon, we all know that the money is there, meaning the money in this ecosystem is there to pay for the medications that we need to stay healthy, to stay alive. And it's being extracted to the point that there's nothing left for the pharmacist, for the business, for the care provider to do their job. And it's all being sucked up into profit for Optum or Express Scripts or CVS Health. And that's where I become in anger. If you're a well-off organization and you're capitalistic and you're just making a ton of money, as long as you're doing what you're supposed to be doing to take the meaning, let's call it the minimum. At least we're providing care. We're paying our expenses. We're keeping our pharmacist in business. But we have a model that it's all working. It's not working. Like the money is there and the money is being sucked up by the PBM in the form of profit over healthcare. And no one in this metric now, and no one in this ecosystem can argue that anymore, because everybody knows, based on the data that we have now extracted, that it's the profits that is the cancer to this healthcare issue and the healthcare insurance coverage issue. And it's also education. We have pharmacists now that are educating our consumers and saying there's sometimes you don't have to use your insurance, and there's other times that you most definitely have to use your insurance. In the case of Cole, 22-year-old kid, I didn't have two stones. It makes me sound old when I say that phrase. Two stones to rub together. But I don't have that kind of. I don't have that. I didn't have an extra 500, 100. No. I don't think I had an extra $10 when I was 22 years old. I think I was living with my grandmother still. But if I was asked to keep my breath going for $500, I wouldn't be able to do that. And you shouldn't. And based on our healthcare system's infrastructure in the United States of America, is supposed to be the most glorious of countries on face of the planet Earth, which it could be. It's a broken system that the public and our Congress people that is supposed to protect the public have allowed to bastardize and transform into this monster that's not about anything about healthcare. It's just about profit.
Totally about profit. I just think, when in Wisconsin, looking back at the beginning of the year, listening to that, Shannon, I think I had mentioned this to you before, it just infuriated me, that they were saying, well, if we enact these changes, it can increase the amount of coverage for patients. They'll be able to use their insurance more, or, it's like those are barriers that we put in place for a purpose, but they're barriers to the people that are also, that have most chronic illnesses. And,
right.
As far as what seeing that these pharmacists are consistently losing money, not just by a few cents. I've seen hundreds of dollars for one prescription that they're losing money on. Every time I fill my son's prescription, there's not a thought, there's not a day that goes by that the thought doesn't go through my head I'm thinking, I really hope that they're getting paid. And I don't know, but I can tell you this much, I'm going to fight for them until they do, because I don't think that there is anyone in America that expects these pharmacists outside of PICMA, and the PBM's. PICMA is Pharmaceutical Care Management Association. That's the lobbyist association for these pharmacy benefit managers. I don't see other people just saying, oh, okay, it's all right that they don't get paid. I'm sorry, but shareholders should not make a penny until the people providing the services do. I'm tired of seeing their profits and, the shareholders just continue to profit as we suffer and our pharmacies close. And that has to change in America. And legislators need to get it, because pharmacists are so critical to healthcare in America and to our public health. It frustrates me to see they're just able to do this without any consequences again, just profit. It's all about profit.
And do you feel like, at least our experience in talking through all of this in these last few months with folks, is that even providers, your PAs, NPs, and doctors don't even realize, sometimes don't even know what a PBM is, which is crazy to me, right? But then also, when we have to call our doctor and be like, hey, they didn't cover it, or they want me to try something else, the doctor is like, what? They don't understand. It's like you said, Todd, so broken that the person that saw me, examined me, listened to my heart, did my blood work, prescribed me a medication, and now someone else gets to say, nah, we don't think so. That just doesn't compute in my head. And talking with some physicians, never heard of a PBM, and they're like, well, gee, that makes a lot of sense. It just baffles me that a medical system that, again, is supposed to take care of us and keep us alive, quite literally, doesn't mesh, doesn't work together the way it's supposed to.
True.
Right.
It's never supposed to become this.
Right.
The PBM was designed back in the 80s to become an administrator of how to take the benefit money and associate it with the right medication, as well as contracting with pharma manufacturers in order to get good prices. And originally, when they did that for cents, right? When they did that for 25 cents or 20 cents or 10 cents, whatever the administrative cost was, it was just a side thing. It had nothing to do with profit. It had nothing, it didn't even become wasn't that much even of a cost center. It was really an administrator. It was an administration, which now today with our technology and artificial intelligence, no PBMs and PCMA doesn't want us to tell anyone this, but you could literally have an AI system running a PBM for cents on the dollar of what they're charging the American health system from a taxpayer perspective to suck up as much profit as possible. And they call it something else. They pretend that it's safe, but it's not. Mail orders, not safe. Talking to an 800 number and a person on the phone that's not your pharmacist and not your physician, that's not safe. Putting your healthcare in the local form where a physician or a pharmacist can literally see you. They can see the pastiness of your skin, or they can smell something on your breath, or they can look at you in the eye and talk to you about what you're going through and look at, oh my gosh, you're turning blue. You're not breathing. Like, let's get you some help. That's healthcare. And there's enough money to pay for healthcare, but there's not right now in a broken system because of this pretending of the PCMAs and the PBMs. They pretend that it's this way, but it's not. And everybody wants to complex it. Rebate and this number and this over here and this. The question the consumer needs to ask, is there enough money to pay for my health care? Yes or no? The answer is yes. Done. Everything else after my care is paid for, which means my provider gets paid and means that I get everything I need paid. Everything else comes tertiary, secondary, tertiary, fourth place, fifth place. But that's not happening. Profit is number one. And if we don't get our profit, nobody gets healthcare. And that's literally what's happened to PBMs and insurance companies. They're taking our United States healthcare system hostage. And we know this is factual. The reason why we do know this, Shanon and Loretta, is because people are flying out of the country into Mexico and into Canada. They're getting the same coverage. They're getting the same therapy. They're getting the same medication. They're getting the same care, if not better care, and they're paying fractions of costs of what we're paying here. So we're stuck. Nobody wants to listen because some of the politicians, not all, some of these politicians are so ingrained into the pay system of passing legislation that keeps them in power that it breaks up what healthcare was originally supposed to be. It's not, we're not talking about who makes the best automobile, right? And even that has more legislation than what our PBMs have. We're not talking about how to sell plywood, through your hardware store. And hardware stores don't get their money taken back from them 3 months later because they didn't have the wood in the right position and the right color. And the hardware administrators came in and took back all the money from the hardware store because you didn't do it right. There's no such thing as that. But now we're talking about people's lives, and we have to navigate, and we have to do jujitsu, and you have to have Antonio Chacha come in with a calculator, a scientific calculator, and dissect things for 7 days and blah, 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 blah. It was never, ever supposed to be that complicated. And Cole was supposed to be here right now.
Agree. No mother, no patient should ever lose their life for something that I believe I had read, Shanon, correct me if I'm wrong, but there was a medication that would have been like around $30 that he could have, accessed if he would have known about it. And to think about that, all the money that we put into this healthcare system, I'm sorry, how in the world do we not, how do we let someone walk away for $30? No, no, like that's got to stop. It really infuriates me. And you had mentioned, how the way if he would have went to an independent pharmacy, they would have said, "What do you need?" We would get it. I have a story like that. There was a pharmacist in Florida whose patient was overdosing, and the mother had drove her in. And immediately, upon walking in the store, it was like the pharmacy tech just knew what to do. She knew what was happening. She grabbed what she needed, went and gave the patient the treatment, and saved her life. And if that independent pharmacy would have not been there, if they would be forced to close their doors, and they're struggling right now too, it's like that patient wouldn't be here today. So it's just where you have a lot of red tape with these chain pharmacies. You don't get that, with the independent pharmacies so much. And right. I wonder if at chain pharmacies, if they're not required to say the higher cost drugs sometimes, just the way that things seem to be working. And I know recently there was something that was shared where now CVS also manufactures medication. So they were actually giving a $200 gift card or some type of credit to patients that would switch to their manufactured medication. And it's like, come on. I mean, this is just out of control with PBMs and how they're vertically integrating and monopolizing the industry at the cost of patients' lives.
Yeah. When we did a different interview with a reporter, they asked me, like, what's your goal? And I just was like, it really is nothing. None of this has to be so complex, right? It is so simple, but we've created this monster. I said, my goal is that any one of us can have a prescription from our doctor, go to a pharmacy of our choice, and pay a reasonable price and receive that medication. I'm baffled at why that is so complicated now. I don't understand. I mean, I'm starting to understand, don't get me wrong. I don't like it, but when people ask me, what is your goal? That's it. I don't feel like that's a big ask. I really don't. I think that, like you guys have both said, as Americans, as human beings, any of us should be able to do that. That seems like a real simple, reasonable ask.
Right. We expect that. We expect that as patients, as a mom, I expect that, and I will not take any less. And the fact that CVS is attempting to steal the prescription for my husband's prescription for themselves, just wait, because that's going to, you would think that when the Boesings call, CVS would have something like lighting up saying, oh my goodness, we better get this right. We better not do it. No, they don't. They see me as somebody they can just blow off because, they know I'm not the one that writes the rules. It's our legislators that they're afraid of. So people that are listening, that you need to take our stories and bring it to your legislators and say, what is this? Why is this happening? You're right. As Americans, we expect this simplicity of we go to the pharmacy of our choice and our medication is covered. There's so many people that are just shocked when they first get oh no, you have to use this pharmacy. It's like, wait a second, this just doesn't feel right. This is America. And, we're all about, freedom. And here we have this freedom absolutely stripped from our hands. Our children are suffering. Patients are dying. The number of patients that I have connected with that are on my page that have lost their children or who have been harmed, it's too many, and it has to stop. It is simple. It has to stop. We pay too much for this poor level of care and to watch our pharmacies close. So
absolutely.
I just hope people will be empowered and do more.
I agree. I think too that people, you mentioned this in the beginning, Loretta, they hear like your story or my story and they're like, well, mine's not that bad. Right. And I really want to stress to anyone that's listening is every story matters. So like I said, there's, whether you are on it, Cole was on an ADD medication, and went through something very similar. In fact, that's why he switched insurances just in 2023, because all of a sudden he was being told he had to try a different ADD medication after one had been working for him for forever. It doesn't matter if it's that, it's all important. It's all healthcare. It doesn't matter if it's severe or not, because it's all healthcare. So I think that too, on like the Patient Protector website, sharing your stories and I don't think people realize that this is happening to the person sitting next to you, to their mom, to their kid, to their sister, every day, all the time. I work right now in addiction medicine, and it happens to my patients every day. So again, it's just that like lack of knowledge and education, but also just lack of realization that every story is important to get out there, so that our legislators and our lawmakers hear that we're all experiencing this. This isn't just Shannon's son passed away because of this. Oh my goodness, we need to create a law because one human died. Don't get me wrong, I think that. But it's happening to every single one of us, really, in some fashion, at some level.
You're so right. And that's what I wish people would understand too, is that it does. See, for me in the beginning, I had so much support, and it seemed like there were so many people that were going to help me. And the ones that really continued on with me were the pharmacists and the patients that had been harmed. Please, people, don't get numb to these issues. Don't your own story. Well, that was a bad that happened, but then they fixed it. It took a couple months. I suffered for that couple months, but I'm okay now. No, next time it can be your life. Next time it can be your child's life. You have to care enough now to take the steps to get involved. You cannot delay it. And, the issue that I started with was the temperature issues. And I had initially thought that, and that was with Walgreens Pharmacy, that my son's medications were ineffective, liquid oral transplant medications, from being exposed to high temperatures. But I just brushed it off and think, oh, someone's surely regulating that. It's okay. But none of this is regulated. So we have to, we need protection. We need choice of pharmacy, and we have to make sure that our pharmacies are open to be able to access the best in our nation, for patients and for our children.
All right. I want to say thank you to the listeners for plugging in. I also want to make a call out to the listeners. Please share this with someone. Share this with a local representative in your community, whether that's local, state, federal, if you have connections. Also, share this with benefits administrators. Get them involved. Let them know that you want them to be more educated in understanding how PBMs in their current state, at least the three biggest ones that are sucking up 82 to 85% of all prescriptions within the three of those pockets, are just bent. They're not doing things correctly in the right way. And all we're asking for is, like Shanon said, we want our benefit. That's it. We want our healthcare benefit. That's what we pay for as consumers. That's what we pay for as taxpayers. That's what we expect as an American living in a nation that's supposed to be one of the best nations on the face of the earth. And it's failing our people. It's failing our pharmacists. It's failing our communities. It's definitely failing public health. And it certainly failed Cole and Shanon and your family, Shanon. But I want to thank you, Shanon, for being part of the PBM Reform podcast and what little we can do in just pushing messaging out. If there's any follow-up with your organization, with the website patientprotector.us that you mentioned, anything that we can do to help promote this, we will definitely do so. But Loretta, thanks for coming back, and Shanon, thank you so much for sharing your very important story.
Thank you.
Thank you.
PBM reform is not a textbook process. This component of healthcare insurance will take time to figure out and will consist of many different players of the pharmaceutical supply chain. If you'd like to contribute information, data, or your own insights on PBM reform, please contact the Pharmacy Podcast Network. Send your email to publisher@pharmacypodcast.com or call us at 412-585-4001.